Good morning from New York City, where many of us are hunkered down, still in the midst of the COVID-19, but with some news good news that we are some days past the peak in New York State. Good afternoon and good evening to all participants from other parts of the world who are joining us today. On behalf of the organizers of this webinar, you can see them at the bottom of the screen. I would like to warmly welcome you to this webinar on COVID-19 experiences of countries that are ahead of the global curve and looking at country-to-country learning and South-South cooperation. Next slide, please. This webinar is the eighth in the series of webinar on social protection responses to COVID-19. This webinar series is a joint effort initiated by the International Policy Center for Inclusive Growth, IPCIG, by GIZ on behalf of the German Federal Ministry of Economic Development and Cooperation, BMZ, and the Australian government's Department of Foreign Affairs and Trade, DFAT, in collaboration with the team from socialprotection.org and colleagues from different parts of the world and organizations who are working together to discuss and disseminate information on social protection measures for COVID-19. This initiative has three major components. One is a weekly newsletter that I invite you to check out. It features up-to-date information on this topic. The second component is a weekly webinar, such as what we are having now. Usually this is on Tuesdays, but also organized on other days, like today when necessary. And these webinars provide a global platform for discussion and exchanges. The third component of this initiative is an online community that has been set up by the founding organizations. And we invite you to join this online platform where you can have access to the information from different parts of the world and also take part in the discussions and also to initiate discussions that you might be interested in all online. Next slide, please. So just to flag that the upcoming webinars that are programmed, again, back on the Tuesday schedule, this coming Tuesday on May 5th, the webinar will be on social protection financing in the wake of COVID-19 and beyond. And the week after that, the webinar will tackle universal health coverage or the absence of that in many countries. And in light of the coronavirus crisis, what are the challenges and responses in maintaining essential health services in the midst of the COVID-19 crisis. Next slide, please. So this webinar will look at experiences of countries. We are very fortunate that we have with us here colleagues who will talk about the experiences of China, as well as the Republic of Korea, countries that are ahead of the global pandemic curve, but also countries that are considered able to mount a successful response to the pandemic in terms of the metrics on controlling the spread of the virus and flattening the curve, but also in keeping to the minimum the number of fatalities from COVID-19. We will also have the opportunity to hear from India and hear a response from our regional and the local perspective. So we are very happy to have that presentation as well with us today. And of course, the value of country-to-country learning in the midst of this situation and South-South cooperation. COVID-19 has now spread to over 180 countries and still growing, and we are still counting, and many countries are still to see their peaks, with a devastating impact, firstly on health and survival and the health sector. And as economic activities are significantly reduced or are shut down in some places, the impact on the livelihoods and well-being of population groups, including those that are already vulnerable before the crisis, but also groups of people made vulnerable by this crisis. And in the medium and long term, we are also seeing now the effect on the economies of countries with economic downturns and instabilities, as well as the potential risk to the global economy. In previous webinars in this series, we discussed different models of social protection that are adopted and that can be expanded to meet the demand of this pandemic. But also we had the opportunity to hear before in the previous webinars the social protection schemes that are already being put in place by governments as part of their national COVID responses. We heard the experiences of the models that are being implemented in countries in OECD, and also examples such as Jordan or Indonesia and other countries. And in all of this, we're also seeing trends on who are more affected by this crisis and which segment of the economy, in particular, for example, accommodation, the food and travel industries. So the point of our discussion in today's webinar is to look at the national responses at the national level, as well as the regional and at the city level. How are governments putting together these measures in the health sector, in the social protection measures, and economic measures, and then how are these coming together in what the government of Korea would say a whole of government response, or at least a coordinated national response to the pandemic. But countries are coming from different contexts, different situations, also different social practices and behaviors, but also in the capacities of the health systems and social protection services. And also, and in that way, governments are making trade-offs in terms of balancing their priorities against resources that are available to them. And we are seeing a lot of creativity and a lot of innovation. Governments are acknowledging that this is uncharted territory. And so in this regard, more than ever, country-to-country learning and South-South and triangular cooperation is not only very timely, but also very essential. We are already seeing, even as we speak, countries looking at what is happening in Wuhan and how they're opening, countries looking at what is happening in Lombardy, in Singapore, potential for a second wave, the good practices coming from the Republic of Korea. So this in country-to-country learning is happening, but also the support that countries are providing to countries hit hard by the pandemic, even as they themselves are still responding to COVID-19. So we hear of doctors going to countries for medical supplies provided by countries and medical equipment and medical expertise. So we look forward to the presentation on South-South and triangular cooperation and international cooperation on how countries are coming together to defeat this, to address this particular challenge. From the UNICEF side, we are very concerned that although children, of course, are not the primary victims of COVID-19, but as the health services are under severe stress, that the delivery of basic health services will be interrupted. The World Health Organization reported that the increased number of deaths caused by measles, malaria, HIV/AIDS, and tuberculosis that are attributable to health system failures exceeded deaths from Ebola in countries that are hardest hit by Ebola. So as Director Madame Henrietta Fore noted, we cannot save a child from COVID-19 and then lose lose their jobs and businesses, children come and become very, very vulnerable. And so we are looking at social protection measures to ensure the health, nutrition, and well-being of children as well as their education. So with that, we are looking at the presentations to see how governments are able to balance these competing and very urgent priorities at the same time as they mount a national response to mitigate the impact of to contain as well as to mitigate the impact of COVID-19 at the international level, how we are coming together, including through South-South and triangular cooperation to mount a successful global response. Next slide, please. So for our first presentation today, we have no better person than Mr. Jorge Chediak to take us through some of the initiatives that are ongoing now on South-South and triangular cooperation to provide support to the global response. Mr. Chediak is the director of the United Nations Office for South-South Cooperation, and he is also the UN Secretary General's envoy on South-South Cooperation. You can see on the screen the information on Mr. Jorge's illustrious career. And Jorge, we are very happy to have you with us today and to be part of this discussion moving forward on the global response to COVID-19. Now, next slide, please. For our speaker to share with us the experience in India and looking at the local regional level, we are very happy to have Mr. Mihir Bhatt, the director of the All India Disaster Migration Institute. Mr. Bhatt, I really want to thank you for making the time to join us, knowing that you are in the midst of responding to this to COVID-19 in your city. And so this is not only lessons learned, but this is real-time learning from your ongoing experience. Mr. Bhatt has extensive experience in disaster risk management, especially in the Asia-Pacific region, working with different organizations in different capacities. And he also promotes South-South and triangular cooperation. So Mr. Bhatt, we are very happy to have you with us, and we look forward to your presentation. Next slide, please. And for the experience of China, we are very fortunate to have with us Mr. Taidong Zhu, who is the director at the Center for International Knowledge on Development, CIKD, at the Development Research Center of the State Council in China. Mr. Zhu has extensive experience in international development cooperation, and his academic background is on public policy and international law. And he has extensive experience as well on the projects involving under the Belt and Road Initiative of China. And Mr. Zhu, we look forward to your presentation on the China experience on COVID-19. And our third country presentation, not in any way the least, we have from the Republic of Korea, Professor Yang Jun Choi. Dr. Choi is the assistant professor at the Department of Social and Preventive Medicine in Hallyu University of College of Medicine in South Korea, and also a colleague of us, currently engaged with UNICEF as a public health consultant in UNICEF's Seoul office. We are very lucky to have you, Dr. Choi, with us. Dr. Choi has extensive knowledge on epidemiology, infectious diseases, as in particular respiratory virus transmission. So this is very, very relevant to our discussion today on COVID-19, and also experience in knowledge on the effectiveness and impact of control measures. And also joining us in the panel, we have the Deputy Director for Programs and Operations at the UN Office for South-South Cooperation, Ms. Shajun Grace Wang. Grace, we are very happy that you are joining us today. Ms. Wang will deliver the closing remarks for this webinar and also highlight some of the key points from our discussion. Before joining the UN Office for South-South Cooperation, Grace has worked extensively with with UNDP, and also initiated the establishment of the Global Coalition of Think Tank Networks for South-South Cooperation. Grace, we're very happy that you are here with us today. Next slide, please. And my name is Marta Santos. I'm the Program Manager for South-South and Triangular Cooperation at UNICEF, and I'm very happy to be your moderator for today's webinar. Next slide, please. We will not have the opportunity to give the microphone to our participants because of the number, but please type your questions to the speakers on the chat bar, and we will address that in the Q&A portion of this webinar after the fourth presentation. We will also respond to all the questions in writing and send this to the participants some days after the webinar, including the summary of this discussion. However, the recording and the presentation from the webinar will be immediately available on the socialprotection.org website. So with that introduction, and not to use any more time, I would like to hand over the floor now to Mr. Jorge Chediak to give the opening remarks, but also to take us through some of the work on South-South and triangular cooperation. Jorge, you have the floor, please.
Thank you very much, Marta. It's a real pleasure for me to be part of this event, considering the partnerships involved here. First, the experiences from 3 countries that have shown that this virus can be fought and this pandemic can be fought, and we have answers to the challenges it presents, both at the health, humanitarian, and developmental dimensions. In addition, I'm very proud to have this event co-sponsored with UNICEF, an organization within the UN system that is a model of how it commits itself to the rights of the child, and particularly with the International Policy Center for Inclusive Growth. One of the highlights of my professional career with the UN was to be the director of the center for 4 years in the middle of last decade. And I'm very proud that I was the one who launched the social protection network that now has become a point of reference for this type of exchanges. And also to show that it could adapt itself to the new reality of the pandemic. Because one thing we have to point out is that there will be a before and after in the world from this pandemic. The health effects are well known, but in addition, it is cascading into massive social and economic dimensions. Billions of jobs are being threatened, and many of them outright destroyed by the measures that need to be taken to combat the spread. The fiscal policies and the monetary policies of countries have been radically changed to confront the challenges of the freezing economies, and it is still a question in the air what will happen in the aftermath to the new normal that should emerge from this reality. Also, the reality of international cooperation will be certainly affected. And in this context, it is very important for the countries of the South not to lose sight of the importance of South-South cooperation, but also at the same time, not to lose the basic principle of South-South cooperation that is complementary to North-South cooperation, and the developed countries should not use this situation as an excuse to curtail their commitments to providing resources, provided market access, provided finance to the countries of the South. I want to highlight a couple of challenges before listening to the experiences of the real extraordinary speakers that we have that will follow me. One is, in some cases, this response has led to coordinated responses among countries of the South. In addition to the national ones, the attempts to undertake joint initiatives at the regional level. And I think in the case of Africa, we have some good examples, and we'll hear about some of the initiatives in Asia. But at the same time, we also have other cases in which some of the good integration initiatives that were going on in the South have been threatened by the measures that the governments are taking to COVID, including the closing of borders, the reimposition of trade and financial restrictions, and others. So for us, we're extremely optimistic of the trends of the evolution of the Southern integration. We have to think how we can restore and reinvigorate this process after this pandemic. Similar trends are perceived at the global level. The possibilities and the calls to reduce or to shorten the global supply chains conceptually is very simple, but in practical terms, it might mean limited possibilities of integration to those chains, 5 countries of the South. So that will have significant implications also to the post-development. So what are we doing from UNOSSE? The UNOSSE, we're trying to get the minds of the South and the friends of the North also to think about how to answer the immediate crisis on all the dimensions, health, humanitarian, socioeconomic, but also to think the future. In that context, we have our platform Galaxy that is at the disposal of all the partners to share ideas. We also have mobilized through our global network of think tanks, thinkers from all over the South to try to remove from the day-to-day reality and think the future. And my office remains committed to be in a space for this type of reflections and also eventually for some programmatic exchanges. So thank you very much again to the participants, the panelists, and also we're very proud to continue this process of exchanging knowledge among countries of the South to have a better response. Thank you very much, and the floor is back to the moderator.
Thank you very much, Jorge, for that insightful overview and the opening remarks. I now give the floor to Mr. Mihir Bhatt for the experience from India. Mr. Bhatt, you have the floor, please.
Thank you so much. Thank you, Santos, and Jorge, thank you so much for this opportunity to talk about the work that's happening in India and in the state of Kerala. As an opening remark, I would very much like to say that two of the areas which are hugely neglected, in my opinion, which is South-South cooperation and social protection, you brought them together. So I'm very, very happy that has happened. I'd like to start with an overall situation in India and would like to point out that there are a couple of facts we cannot forget when we talk about the pandemic. One is that 1.3 billion population of India, with many yet not under social protection, are involved in what we are talking about, 1.3 million. Second, it's the largest democracy claiming and reclaiming and unclaiming social protection in terms of its nature and its extent. And that's a major feature of the context within which the response is taking place. And third, it is the largest economy in terms of purchasing power parity, where very few people have a large purchasing power in terms of amounts, and many, many people, millions of people, have very small purchasing power, but large in number. So within this context, the social protection for the most vulnerable against coronavirus that we are talking about. Almost 176 million people are about to march out of poverty and have enough social protection. They've not yet done it, but that is what country is going through when this particular COVID-19 happened upon us, which included health, education, and female participation in the labor force. So that is a very important fact to keep in mind when we look at the response that is taking place. As of April 27, 28,000 confirmed, 6,500 recovered, thank God, and sadly, very sadly, 886 have perished. In that context, I'd like to tell you what the response has been and what measures are taken to manage this in India and in the state of Kerala, which is a very important state. Within India, the main aim was to flatten the curve, as we know, and the main tool that was used to have what is called social, perhaps more appropriately physical distancing as a means of achieving that. From March 24th to May 3rd, we'll know whether it's extended or no, but for this period, the national lockdown has taken place, which also means lockdown of the social protection products and services. We can't forget that. The economic calamity that is set upon us because of this lockdown, which is due to the COVID-19, is huge. It's huge. The GDP from 6.3%, may God forbid, will come down to 1.8, as the estimates so far suggest, I hope it is not as bad as it is predicted. The damage to existing social protection and greater demand for emerging social protection measures are increasing. So really social protection has been at the forefront of what is happening in terms of measures that are being taken. In the state of Kerala particularly, I'd like to mention two major important measures that are taken. One is the state government decided to surge, to expand the social protection measures that already existed. And this is a state where fairly good social protection measures are taken place during a normal development period. And then they added additional measures within social protection to make sure that the claims of COVID violence have become more controllable. And second, this is very important, that the surge in Kerala was local, was decentralized across various districts, and third, it was done, the decisions were taken by the panchayats, which is the local block level people's elected bodies, that how the social protection measures will address this unfolding of a large impact that virus had on them. Let me add now to something to add specifically in terms of social protection and other measures that were taken nationally and in the state of Kerala. Nationally, many measures were taken. Three of them I'd like to highlight, which I think is very important for our discussion here. One is that 400 million workers, this is ILO figure, from the informal sector of the Indian economy, who were without social protection or were reaching social protection by various recent measures, are directly affected. 400 million workers. And $4.48 billion were given to these workers. The process is still on, and performance we will see very soon, through the Gramin Kalyan Yojana, loosely translated Rural Welfare Program. $4.48 billion worth of direct cash transfer to this large number of people is taking place. And third, at national level, cash and food support of 1.7 trillion rupees is going down to these people. So it's the largest social protection measure ever taken in the shortest period of time in a country of India's size and diversity. Going to Kerala, let me point out that first, and I was amazed in a short time, 18 specifications of standards were worked out by the state government, which included standards for social protection. The highest recovery from people who were affected and lowest mortality was achieved by the state. We are not out of it yet, but we hope the trend will continue. They hired people, health sector people from the private sector to come into the public arena to help out in this. Public-private separation was removed as far as health response was concerned. The largest spread of testing of COVID was taken all across the state in all the districts, especially innovative measures such as kiosks where you could walk up and get tested, where you had at least 2 hospitals in each of the districts, mostly the largest hospitals, where you could go and avail of any of the measures related to COVID. Telemedicine was done and is being done in terms of thousands all across the state. 1,400 community kitchens are running around the clock to make sure that anybody who has not had food is receiving that food. And 5,500 migrant labor camps, what are called guest worker camps, which are being set up. Workers will come from other states of India to work in Kerala. All of this is decentralized, as I said before, and all of this is localized, as I said before. So this is the largest decentralized and localized social protection measure that a state government has taken. And many other states are picking up from this kind of social south within the country, if you will. Let me go to the lessons learned and recommendations, if I may, from what we have just heard from me. It's very early. We really don't know where things are going, but we all hope and pray it's going for better. India, one thing it is very clear that 35,000 villages in 56 specific districts will receive migrant workers simultaneously. Such large movement of people, workers, has not taken place before in such a short time. Within that, PDS, that is Public Distribution System, NREGE, National Rural Employment Guarantee Program, early pensions, child care, food for the children at school, midday meal, cash transfer, as I described before, and also food is being offered to this large number of people. Many of them are in between, neither at their work nor at home. They are being taken care of. Of course, there are difficulties. Of course, there are major challenges. But these measures are being taken by the government. Civil society has also jumped in, including UN systems as well. And third, at the national level, if early and substantial flow of resources at local level has helped. Wherever the resources have reached early on, you see that the impact is not as bad on the poor and most vulnerable. Where it is taking time, you see that the impact is spreading rather in a negative aspects. In Kerala itself, a couple of things I'd like to point out as lessons learned. One is a higher public spending on labor and health as reduces the impact. So when you have already spent more on health and labor, social protection for the labor, the impact of pandemics, by and large, generally speaking, would be less. Second lesson is that better economic and social care of migrant workers, such as the camps that I described, but many, many more measures that can and should be taken, helps those migrant workers, but also helps their contractors, helps local people, helps people back at home. It helps everybody. So it's very important to offer social protection as well as right now immediate relief and rehabilitation measures to the migrant workers. It's in everybody's interest. Third thing, which is very, very important from Kerala, and I think many more need to learn about that, is the leadership and the convergence of three agencies. One is the Planning Board of Kerala, continuously long-term objective, short-term objective, immediate objective, long-term objective. That continuously planning is ongoing, besides economic development planning, looking at the response to COVID, in integration and coordination with the Kerala State Disaster Management Authority. And let me tell you, this authority is very busy coming out of a major flood of 2018, is in the middle of very crucial phase of recovery, and coronavirus, COVID-19 came, but they have responded beautifully. And third is a new special purpose vehicle created called Rebuilding Kerala Initiative for Climate Resilient and Sustainable Kerala. And they have joined in their effort, their resources, technical know-how. Three of them together, we have seen, have been able to address the challenge far better. And fourth, and the last lesson from Kerala, I'd like to say, is about the lockdown. This lockdown concept in India is very special. And what we have found is there is no one way of doing the lockdown. There are multiple ways of doing it. And there's telescoping lockdown that other countries may want to learn from time to time. May God forbid should there be another pandemic. There's a blanket lockdown that we all are aware of. There is a hotspot where you contain the virus where it is of the specific pandemic. So a lot of knowledge, method, practical tools, technicality is being converted from this particular approach to lockdown. And we will hear the same thing also about the economic relief, rehabilitation, and recovery measure that that India is taking. Let me sum up. Let me sum up by offering 3 opportunities for South-South cooperation. The list is longer, and I can go on, but I think for our immediate purpose, 3. One, I think it would be wonderful. It would be wonderful if we set up a high-level committee on South-South cooperation, United Nations, governments, maybe civil society organizations, and research institutes, why not, on COVID-19 recovery and social protection. That how social protection and COVID-19 recovery is taking place through South-South cooperation. A high-level committee can do that. And I think what needs to be looked at in terms of reference would be quite there from the Future of Work report that the Global Commission of ILO has set up. So that's something which will be very concrete, which can come out from today's discussion, a high-level committee on COVID-19 and social protection for South-South cooperation. The second measure I'd like to suggest very much, and looking at India's response in Kerala, is to draw out and exchange the broad best practices for COVID-19 recovery and social development goals, which focus on health and jobs specifically, and social protection. What is happening is that wherever the SDGs are better, the impact is lower. And I think that practice needs to be brought out, not only from Kerala, not only from India, from all across the world. So we know that what works, what doesn't work, when development is actually done in a sustainable, in a clean, green manner, social protection included, the impact of pandemic is low. And what does it need for that purpose? The tools, the concepts, the new skills that are required, and that would be a good South-South exchange that I would suggest. And last, and I would like to end with that, to say that we must accelerate the sustainable human development around COVID recovery, with specific focus on health and childcare, and I hope UNICEF agrees with that, and social protection with overall interest. Because what is happening is the impact on economy is terrible, but we'll come out of it. Impact on nature is terrible, we hopefully come out of it. But impact on social protection and therefore the human development that is going to be for generations to be affected. And that is something would be a long drawn South-South exchange in terms of what is it that we can do so that the human development doesn't slow down, actually is enriched further and further. With this, I'd like to end and say I'm so happy that the continuous neglect of social protection and South-South cooperation in the national agenda, international agenda, has actually now been added to the forefront because of the COVID-19. It's a sad way to get the center stage, but I think it's an important way to get the center stage. Thank you very much, Mrs. Santos. I really appreciate this effort. Thank you very much to my panelists.
Thank you so much, Mr. Bhatt, for a very comprehensive presentation, highlighting for us some lessons learned and some of the key interventions from the government. But also thank you for the recommendations in terms of moving forward with South-South cooperation. Luckily, this is recorded, so we do have a full record of your presentation and something that we will definitely go back to, and I'm sure other participants would also, who are not able to join us, would be happy to listen to that. Thank you so much. And now let me give the floor to our speaker from China. Mr. Zhu, you have the floor, please.
Hi. Good evening.
Hi, don't you?
Good morning.
Good.
Yeah.
Thank you.
Can you hear me now? Right.
Yes. And you have the floor. Please turn on your camera.
Can you see me? Can you hear me now?
Yes.
Okay. Clear?
We can hear you. The camera is not very clear yet, but hopefully it will clear as you speak. We
okay.
can hear you.
Okay. Thank you. Thank you all. I think the speech is just now by Mr. Chetik and also Mr. Bahat is very, very interesting and comprehensive. And my sincere thanks to UNOSSC and UNICEF for inviting me to such an important event. So following the framework like we were giving, so I would like to talk about like 5 topics. So the first one is sort of the overall COVID-19 situation in China. Today actually is sort of a milestone point because Beijing reduced its risk level to level 2 because Beijing has been sort of keeping the highest level for since COVID-19 was announced. So this largely meant this pandemic is largely has been largely contained in China. Actually, for this month, for the April, the cases, daily cases, has never been up to 150, and over the past 1 or 2 weeks is less than 20. So altogether, China reported like 82,086 sort of confirmed cases, and the deaths is the recovered one is 77,610. So that's like the general case. So in terms of the overall response and the management of the epidemic, we think there are sort of 4 stages in China, and in the different stages and in the different phases, the strategies are different. So the first stage we think is like from the detection, since COVID-19 was originally in Wuhan, and so that's the first stage is from the end of 2019 to January 20th this year. That stage, China focused on information collection, sharing, and analysis. And the health departments led response actions because there's a timeline to get to know disease. So the major strategies took in that stage was just to collect and monitor cases, control infection sources at the local level, largely in Wuhan, and analyze the transmissibility and treatment methods. So that's the first stage. The second stage is from January 20th to February 23rd. So that's a very critical month for China's fighting of COVID-19 or containment of 19. So in this sort of period, a very strict, what China called the most thorough, the strictest and the most comprehensive strategy was adopted. So Wuhan was sort of locked down, and the different provinces was largely actually locked down. Even different villages, they cut off all the transportations or people traveling sort of across different villages or different regions. So in that stage, we can see there is sort of a whole government and a whole of society approach here. China sort of, we have this 5 earliest, sort of early detection, early reporting, early isolation, early diagnosis, and early treatment. So in this period, it's like the whole country was concentrating, using every effort to fight the virus. And then, on February 20th, the Chinese government convened a very large-scale meeting to given the sort of flatten the curve flattening, and then we had a meeting on sort of advanced economic recovery and also the fighting of the COVID-19. And then the third stage is from that day to mid-March. So the nation is China moved from nationwide strict prevention and control to risk-oriented and differentiated approach. So that so it has given sort of risk scales to different regions, and then work was encouraged to resume in the less sort of hit areas. So that's the third stage. The fourth stage is largely from since late March. So China domestically, China has largely cut off the chain of transmission at home, but there were sort of outbreaks across Europe and across America. So the effort has been sort of focusing on what China called it the imported case. So that means people traveling to China or traveling back to China, and the situation has largely been sort of controlled. Altogether, sort of the imported case is less than, I think, 1,700. So and then in this stage, I think two things. One is, of course, to resume work. It's a lot of measures which I will talk below, sort of how to resume work and production. And then the second one is sort of to strengthen international development cooperation or sort of humanitarian assistance. So that's largely the overall response and the management of the pandemic. The third one, the third topic is sort of the social protection and economic measures. Here, I wanted to touch upon some specific measures China has taken in terms of, helping the vulnerable people. The first one, I think, is access to affordable healthcare. So China, at the very beginning, adopted, I think, is a very good policies, sort of, free of charge of COVID-19 related cases. So whether it's testing, whether it's diagnosis, or whether it's treatment, they are all paid by public finance or paid by Medicare, such kind of stuff. So that sort of helped every sort of suspected case to go to the hospital and to have further treatment. And then, China also adopted a new policy on comprehensive healthcare reform during the fighting, sort of building a multi-level medical security system that integrates prevention, testing, and treatment measures within social health protection packages. And then, some sort of small points like, health insurance was sort of encouraged to reimburse online consultations for chronic and common disease. So, people don't need to have more physical contacts. And since January 20th, those who contracted COVID-19 at work also are eligible for employment injury benefits. So this I think, a quick and temporary adjustment of sort of healthcare measures to sort of fight the COVID-19. And then the second, I think, major area that China has worked on is employment protection, because this touched upon many of the vulnerable people. So the first one is providing temporary unemployment assistance for workers. So that means unemployed workers who do not meet the conditions for unemployment social insurance can apply for unemployment assistance during this COVID-19 period. So the second one, I think, from China's experience is about paying special attention to SMEs, because SMEs employed about 80% of the Chinese laborers. So there were a series of measures to help SMEs, such as modifying the payment of social security contributions and tax payments for enterprises. So SMEs in China are allowed to exempt from employers' contribution to 3 social insurance schemes for up to 5 months. These sort of 3 social insurance schemes include pension, unemployment, and employment injury. So and then sort of government procurement opportunities were extended to support SMEs, fees or utility fees or rents. If the SMEs are renting sort of from the state property, all these kind of fees, they were sort of waived. And then the second one, in terms of sort of helping SME, and also one of the largest vulnerable group of people in China is the help migrant workers to come back to work. Can you hear me? Yeah. So to come back to work. So door-to-door transportation was arranged with government's help and coordination. Employment promotion policies especially like creating job matching and job search programs were also encouraged. And here, I think there's one thing like I will touch upon later, is the health code. Sort of digital technology was used to ensure safety of migrant workers in transportation and also cross the region. So this was effective, and I think in South Korea, such sort of measures were also employed. And then there was also, cash flow shortages measures, domestic consumption measures like issuing vouchers, sort of helping, services sector stuff. And in some localities, sort of specific platforms were collected to, to just address any concerns that may raise by SMEs. So that's the second point in terms of employment and promotion and the SMEs help. And then the third one is targeting sort of old age and disability care. So many people were asking, like in Wuhan, the strict lockdown was imposed. So how these older people can live. So in China, I think the situation might be unique. It's like, we had this sort of community management. So people were able to collect information about the solitary elders during such period. Their children cannot visit, and maybe the helpers they cannot help. So volunteers or property management staff, they were assigned to sort of help solitary elders. So this was a good measure to ensure this group of vulnerable people. And then the second one is to pay attention to this nursing homes. So in the very beginning, there was one sort of cluster of cases in one nursing home, and then a lot of attention was paid. So a strict lockdown was imposed on nursing homes, and then all these sort of distancing, sanitary measures were imposed, and the less heat, people in less heat nursing homes were mobilized to support those hard hit ones, like in Wuhan. So this was helping the older ones. And then in terms of like children, so there was family leave and the care policies. The first one, I think, is like many localities in China have sort of issued regulations or policy guidance, like one parent, if their children could not be taken care of, no one is taking care of their children at home, so one parent should be allowed to stay at home and work from home. So that's a very, I think, for me, I think, I have two daughters. I think that's a very good policy. And then the second one is to, use like TV, different platforms to have online education. So China has largely realized, when schools are closed, we are seeing, the learning are continued. So that's like the first one. And the last one, I think, is related to governance. So whether it's sort of, administrative procedures and the delivery mechanisms that are largely dealt with online. So to avoid a sort of physical contacts. So there was many different initiatives in this regard. Due to time constraint, I wanted to go to detail. So I wanted to just quickly share some sort of lessons learned, I think, from China's fight in terms of the COVID-19. I know there's no silver bulletin and every country's case is different, but I think these are some of the experiences when, from China's case. The first one, as I mentioned, is like the whole of government and the whole of society approach. So a comprehensive approach is needed. I think, if we are comparing this COVID-19 with SARS in 2003, we can definitely see how the people are working together, across the different sectors, different groups, and also with the government. So there was many sort of, voluntary behaviors, like people stay at home. They don't want to, go outside of this kind of stuff. So I think this approach is very, very important. And second, I think, is enabling experts to guide the response and protecting, especially health workers and the vulnerable groups. So over the different stages, I think the Chinese, whether it's medical care experts or governance experts, they played very, very important roles instead of like leaving bureaucrats or government officials to play the leading or the key roles in this. The third one, as I mentioned before, I think is digital technology, which is very, very important. Whether it's health code, like to enable people to just check each other's sort of health status, or online education. So digital technology is very, very important. And the fourth one, I think, is nurturing trust between the government, the public and the private sector, and the fight misinformation. During such emergencies, there was many, I think, misinformation and rumors, especially at the very beginning. I think the Chinese government, they used many sort of, government media experts. So they did many sort of public education and sort of, information releasing. So that helped a lot. And the fifth one, of course, is international cooperation is indispensable, which I think everybody highlighted. I don't want to go further. So some of the opportunities for South-South cooperation knowledge sharing, I think just touch 4 points. And the first one, I think, is mentioned by our India friend, is I think the next step about reopening the economy is very, very important. So how to do that? I think there's a big chance for South-South cooperation sharing, since the country's difference might be less. And the second one, I think, is after, if we can see the after ones, the healthcare system building. I think that it should be a very important area for South-South cooperation knowledge sharing, to have more sort of focusing on the social area and also healthcare ones. The third one, digital technology. I think that is very important. Third one is public communication, how to do the public communication, then sort of nurturing trust between different sectors. That's all. I think it's a long time, but thank you all for the attention. Over to you, Lisa.
Thank you so much, Mr. Zhou. Such a very comprehensive presentation. One government response, one society response, very, very important that you highlighted, and all the recommendations. Thank you so much. In the interest of time, I'm going to hand over now to our presentation from the Republic of Korea. Dr. Choi, you have the floor, please.
Sure, thank you.
And Karina, next slide.
Yeah, thank you. Do you guys hear me? So yeah, that's my slide. So hello everyone, my name is Youngjun Choi from South Korea, and I'm going to briefly share about some lessons that we learned in Korea in the past about 103 days from the first regionalist route to the country. Next, please. Yep, thank you. So if we go back 3 months prior, so Korea was along with China that was struck with one of the first wave of the COVID-19. Next, please. And by looking into our epi curve, now it seems like we have flattened the curve a bit, but there were periods that we could see as a pre-epidemic period, and also the surge phases. And I would say there was a period called pre-COVID-19 phase, which we were lucky to have prepared for this. Next, please. So when we rewind the clock a bit, we had the largest outbreak of MERS, or the Middle East Respiratory Syndrome, outside of the Middle East. Also, that has pointed out lots of some problems, such as inadequate public health capacity in various aspects, that led us to prepare for the next introduction of novel pathogen. Next, please. So this quite has enabled us to set up the PCR infrastructures and the early scaling of the testings during the first wave of the COVID-19. And if you see this slide, nearly about 50 days ago, we are testing more people than some of all other countries except for China. Next, please. And the preparedness has been practiced regularly, and it was quite coincidental that a few days before the outbreak was reported, there was a tabletop exercise on disease X, which resembles of somewhere close to coronavirus or Ebola, or somewhere in between. Next, please. So in the beginning, we had the first case of COVID-19 on January 19th. 35-year-old woman coming from Wuhan. And from the clinical evidence, we named it so-called walking pneumonia because this patient did not have any lower respiratory tract infectious symptoms during the first 3 days. even though the patient did have the radiologic evidence of pneumonia. So ringing our bells that this could be very contagious. Next, please. And this finding also was supported by the viral kinetic study that this graph just shows that it literally pours out the virus in the very early phase of the illness. So this was not like SARS or MERS. This is like the flu dynamics is very contagious. So which is followed by our policy making of vigorous contact tracing in the beginning, in the early days. Next slide, please. So, but things happened, and there was a super spreading event linking to a mass gathering in the religious groups. Next, please. Which can be also tracked back to the psychiatric hospitals in one certain area. Next, please. And that just skyrocketed the incidence during the middle of February with a productive number way over 3 and some clusters over 7 or 8. And the numbers just got higher and higher. And next, please. So I took this picture in Seoul Station, which used to be the busiest place in Korea. See how strange that was? Next, please. And there were more than 100 clusters that were tracked and investigated until now. Next, please. So by these outbreaks and clusters were tracked by the classic shoe leather epidemiology, coupled with some support from the IFT infrastructures, including the GPS, cell phone tracking, the video footage from the CCTV, also from the credit card transaction logs. Next, please. And I didn't write the numbers down, but if you, for the first 30 cases, we had tracked it 2,370 contact traces for the 10 to 14 days. So it was a lot. I'm sorry. Next, please. But it seems that we had a relatively low in case fatality rate. It is not sensible to compare in between the countries because we do not have like the equal or similar the testing threshold and the case definition between the countries. But so I don't have a good science to support why we had the low fatality rate at this point. Next, please. But similarly, there was a good triage system that sends the high-risk patient to the national designated hospitals, the isolation units. Next, please. And sending the middle or low-risk patients to the community treatment centers. Next slide, please. And for those who stayed at home were under the close monitoring by the public health officers. Next, please. So by the middle of February, we started to discussing about the social distancing. Next slide, please. Which actually has some impact on both COVID-19. And if you see this curve that shows the influenza activity in Korea, we used to have the two epidemic curves in a given season. But for this year, the social distancing just literally has killed the second wave of the influenza. It was very dramatic decrease. Next slide, please. So from our standpoint, our main interest is in the children and sending them to schools. And we see more and more pediatric cases now, luckily with very mild symptoms or no symptoms at all. Next slide, please. But the kids are shedding more virus for a longer period than adults, also seen in China, also seen in other places of the world, and also seen from one of the first few cases of pediatric cases in Korea as well. Next slide, please. But from our epi data at this moment, we don't see the evidence of the children being more effective compared to adults at this point. But we'll need to see what happens if we loosen the social distancing, because the children could be the main harbors of the community transmission. Next slide, please. So one thing to point out that there was a very strong community engagement, including academic societies and the government, that they have brought the evidence in policy making and developing of the guidelines for the public health measures and clinical side as well. Next slide, please. And one of the guidelines for the children was developed by the Korea Society of Pediatric Infectious Diseases, then was translated by us in UNICEF Seoul office. We'd be happy to share if it could be useful to some places. Next slide, please. So the idea of scaling up of the testing, such as drive-through centers. Next slide, please. I think this is the real picture of the drive-through centers. There were about 70 of them. I think about 82 at most, and at this point about 75. Next slide, please. And also the idea of the walk-through centers came from the academic side as well, which was then adopted by the public that had spread to the country. So there was a very strong public to private partnerships in responding to COVID. Next slide, please. So now we are discussing the transition of so-called social distancing in daily life. Frankly, I would say many are quite frustrated on this at this moment. But on the other hand, we are very thrilled to send the kids back to school. We don't have an exact date at this moment, but we're discussing it now. We'll have to see how it works. Next slide, please. And this will be my last slide. So my takeaway is that going back to the FP 101 on infectious diseases, our goal was just to reduce the transmissibility, to reduce the contact rate, and to reduce the duration of infectiousness through using the mask, hand washing, social distancing, mass testing, contact tracing, and isolation. So I think we think that everyone in this field knows this equation, and I think it was a matter of execution that people have just accepted that the research and evidence-guided policy was the heart of the response against the COVID-19. That'll be all. Thank you.
Thank you so much, Dr. Choi. And may I invite at this point all the presenters to join turn on their camera again for the Q&A. We will not have a lot of time for all the questions, but as we said, we will be addressing all the questions and replying to them in writing. But I just will pick up a few questions for all the presenters to address. Some of them are addressed on South-South cooperation, medical questions, and questions on the response, but I do invite all the presenters to comment on the questions that we will be able to address today. One question is on South-South cooperation. It is on given the combined devastation from recession, financial crisis, and massive health pandemic affecting employment and income hard in the South, how can South-South and triangular cooperation generate demand and also supplies of raw materials from the South? That is one question. Then we also have a question on this being a massive combined health pandemic, recession, and financial debacle. How can the South-South and triangular cooperation help generating demand all over from the South? Then we also have a question on a huge amount of literature these days are focusing on the supply constraint that will be developed through the intellectual property rights. However, intellectual property is also crucial for innovation. How, just a second, how South-South cooperation can be developed as a cooperating mechanism that will protect human motivation to innovate without constraints with the supply. Further, a couple more questions to Mr. Bhatt. The current pandemic has also exposed limitations in India's public health system. What is worse is the poor social protection even for the healthcare personnel. If you could comment on that, please. And then we have also a question on for the prevention and protection, what are the best practices for people who work on large formal and informal market? As you know, in Africa, more than 50% of economic activities are in informal sector. So how can we best address the prevention and protection for people who work without distancing? And finally, some questions on, let me just look into the, what are on the medical question, maybe Dr. Cho, you would be able to address this as well with others. What are the chances of vaccine against COVID-19 would be available to all people of every country as part of social protection programs? And then finally, for Mr. Bhatt as well, what databases were used for the targeting of affected population in India? And finally, one more question that I invite everybody to address. Should we consider social security measures equal to social security policies? And this is specific to India. What is India doing to have as policies, and how is the idea of not yet being under social security realistically being addressed? With those few questions that I read, but also please, I do invite everyone to address other issues that other speakers raised during the presentations. Please let me start with you, Mr. Bhatt, to respond. Your microphone.
Two main questions. One is related to the database that was used, and various state governments and the national government used various data. They were based on some affected population, some people who were coming back from other countries where they had been exposed to. In my own city, for example, city of Ahmedabad, those who had made international travel in last 2 months were started with, and then the database was built up from that. So there were 3 or 4 different approaches to creating the database to start testing. The other question is related to, I think it's from Pinaki, about can we take social policy and social protection, actual performance as same? And no, we have very good policies. They have to perform on the ground, and a lot has to be done both by the government, by the people, and the administration as well. And that is happening. It's not adequate. Far more will happen. So I'm not saying at all for a moment that we should be happy that social protection has taken care of what has happened. And the third question is related to the social protection for the health worker. And that is very, very important. Leave aside the health workers' social protection, their physical protection is very important, because very often people don't want them to come, the health workers, and test them in their communities because of the stigma, because of all other fears. And the government and the civil society is offering protection, physical protection to the health workers to actually turn up and do the testing. Having said that, I'd like to conclude to this saying that not for a moment we should let go of the idea that South-South cooperation is going to solve the problem. What we can do, which I think Sandhya mentioned in her question, is this, that by South-South cooperation will be substantially able to add to the global commons, especially the health and economic commons that we have lost, and we'll be able to achieve that. And we must do that at least in the Asia Pacific, if not the rest of the world. Thank you.
Thank you, Mr. Bhatt, for also emphasizing that South-South cooperation is only one of the modalities in development cooperation that could definitely add value to the global response. Mr. Zhu, over to you, please.
Thank you. I think I've been reading the questions and also hearing your questions. I don't think, given the time, I can address them. I think I wanted to maybe provide 2 resources. One, I think, one thing we are doing here, the organization I mean is the Center for International Knowledge on Development. We have been doing 3 series of knowledge on the COVID-19. One is what we call 100 Q&As, which is largely introducing China's practices or China's sort of ways in terms of understanding the disease, in terms of addressing the disease, in terms of how to including the social protection measures. The second one is we have done a sort of a comparative study between China, Korea, and Singapore to see, you know, what are the similarities and the differences in fighting the COVID-19, and what might be the implications for, you know, countries of different contexts. I think, you know, we can do more. I forgot to suggest, because, you know, each countries may be different, but I think in the end, there actually, we think there are more sort of similarities instead of differences, like what we are arguing. So and that's the sort of second one. The third series, I think, is sort of about how, you know, the different sectors of people are helping. So volunteers, medical workers, enterprises, private sector, what roles they are playing in fighting the COVID-19. So we have been doing that, and you know, have collected some questions, and we can communicate later. So you know, if some questions need a sort of written response, we can definitely provide. And you know, we had this webinar network, and then, you know, all we can do, I think we can do more. And then in terms of international development cooperation, I think I do want to emphasize here, open mind, a cooperation mind now is more important than ever. I think last week we had a meeting with EBRD. I think Gordon Brown was saying, you know, now cooperation is very difficult, but there is no other way. So I think this is definitely important. And thank you for organizing this.
Mr. Stu, very well said. Thank you very much for emphasizing that, and for the comprehensive presentation, but also for sharing those resources. I also know that the Republic of Korea is holding the webinar, so I'm gonna leave Dr. Cho to say maybe something about that, but also to respond to some of the questions and other comments. Dr. Cho, you have the floor.
Yeah, so in terms of the vaccine, I think I can briefly touch on the vaccine issues. So from my understanding, there will be like at least 3 major hurdles. First, it would be the R&D, means research and development. So for the research, we have few good the candidate vaccine proteins and some reverse vaccinology systems, but in terms of development, we don't have a good correlative protection, meaning that we don't have a good measurement of immunity. So that is a major hurdle. And third one would be the manufacturing and scaling up, and then distribution. So for this specific vaccine, it would be the demand would be from like from all around the world. So the manufacturing capacity wouldn't meet all of this all of these demanding countries at once. So there would be some disproportionate distribution between countries in the case if we have the vaccines in hand. So those things are something that should be discussed in advance before we are on the verge of the developing the vaccines. But from our side, as from the public health side, our major concern would be the other like the collaterals from COVID-19, meaning that from Korea, we have like so today was the day that we have zero cases of the domestic transmission. First day in 104 days. We had 4 cases, but those were all from the imported. So this was a very meaningful day, but we also have had this data in head that we had a little slightly lower vaccine coverage for other vaccines, including TTP and MMR, but just the routine vaccinations. So COVID-19 has just diverted or some resources away from the routine health services. So those are the things that we should be also tackling in the at the same time. I think. Thank you.
Thank you so much, and thank you to all the presenters. Also, let me thank, before I hand over to Grace to give the closing remarks, to take this opportunity to thank Karine, Aline, and Mariana in socialprotection.org for making this webinar possible. And of course, Shams Banihani in UNOSSC, who collaborated with me with the team to put this together. Grace, over to you for our closing remarks for this very comprehensive and very important discussion. Grace?
Thank you very now can you hear me?
Yes.
Okay. Thank you very much. This is such an important knowledge exchange. I have learned so much from each country's experiences. And let me summarize. It's very hard to do so, but in 3 words, what I have learned from all the 3 countries. Number 1 is targeting. Number 2 is coordination. And then number 3, very important, cooperation. So I heard from each country that it's important to differentiate the local needs and situation, differentiate different phases of this pandemic and what kind of response you would need to put forward. And also targeting in terms of different needs of people, migrant workers, children, elderly, people with disability. And I'm sure, although you didn't have time to talk about it, you also would take into consideration the gender difference. So targeting is very important, and that relies on communities' action, local action. However, you all also emphasize national coordination. That means whether you issue policy guidance from national government or you coordinate how the country, the whole society act while taking into consideration the different needs of different localities, different groups of people. And cooperation as the 3rd element, not only in terms of internationally South-South cooperation. I heard clearly also from India and China, this kind of in-country solidarity and village to village, city to city cooperation is very important. Basically, cooperation as a human spirit. It works within the border and beyond border. Thank you so much for sharing all this. And I want to summarize and closing by addressing a lot of questions focusing on how South-South cooperation then can play a role to add value as a complementary kind of implementation modality for us to achieve progress in human development. Now, I would like to emphasize maybe 4 aspects that South-South cooperation can do through countries and partners working together. First is policy advocacy. For more solidarity, coordination, and cooperation in today's world, which needs that most, there are several mechanisms we can use. Dr. Bhatt mentioned high-level committee on South-South cooperation. There is such a mechanism under UN General Assembly. Our office serves as the secretariat for the high-level committee on South-South cooperation. In the upcoming discussion, COVID-19 impact will naturally, I think, be included as an important aspect for the committee to discuss. Our office helps to prepare the report to this HLC, and we also will include this dimension, those reports. These are representatives from all countries discussing policy issues. And also beyond that, I think we should, as developing countries collectively, and we are, developing countries are collectively advocating for issues of common concern, especially for the global South, through mechanisms or groups of developing countries. For example, issues related to IPR, right, can be advocated by developing countries for the particular needs. And also we have platforms for LDCs, least developing countries, and landlocked developing countries, Cs. They all have the platforms of groups of developing countries advocating for their agenda. Beyond that, Dr. Bhatt mentioned human development. And we have the Human Development Report, for example. That's an important knowledge product for around the world, and also put forward important policy considerations for policymakers in developing countries. Our office has been working with HDR office to conduct large-scale consultations among 1,000 think tanks. Last year, it was the theme was on inequality. So we organized over 40 inputs from different countries in the global south to advocate for that issue from the southern perspective, and brought in dimensions of how South-South cooperation can help to address inequalities among countries through sub-regional, regional mechanisms, for example. And this year, the topic will be on human development and sustainability. The consultation online is still going on. Today is the last day. Chance will send to you links if you're interested to contribute. So these are examples for what we South-South cooperation can do on policy advocacy level. Secondly, knowledge sharing. I think as Mr. Chediak mentioned at the beginning, that South-South knowledge sharing at this time of crisis has the power of saving lives. It also has the power of lightening up the future. So the 1,000 thinkers are very important to tackle those research questions and policy studies on how the world can better cope and live with the COVID-19. We will need to establish a new normal after this. So that needs thinking and wisdom from the global south. Knowledge sharing on reopening economy, health system building, digital technology, public communication to nurture trust are the concrete topics today you have suggested. We would like to play a facilitating role to continue such kind of dialogue with you and others around the world on those topics, to share, our thoughts and knowledge, and continue share individual countries' approaches is important. It's not to replicate because situations differ, but at least to inspire and adapt, so that knowledge can be used, and knowledge can only be powerful once it's being shared and used. Knowledge sharing through South-South cooperation is very important, and we will continue to do so. The third aspect of South-South cooperation that can add value is to connect partners and funding mechanisms. We already see that countries working with each other, supporting each other in terms of providing medical support, technical advice, urgent supplies, and fast-tracking South-South procurement. It's beyond that. It's also about countries coordinating with each other, especially in the critical period of recovery from the pandemic, including on issues such as trade, investment, and on migration issues, both from the host of the migrant workers and the hosting and the origin country. Regional mechanisms and sub-regional mechanisms play an important role in coordination. The recent example of SARC, India showed clear leadership of contributing, substantially to the SHARC Fund for immediate response for COVID-19. And SARC also organized early on a policy dialogue among all the head of state, head of government, to discuss how they can, as a sub-regional mechanism, address the impact of COVID-19. In terms of funding mechanisms, there are many funding mechanisms established by developing countries to support South-South cooperation. We know examples like IBSA Fund, India, Brazil, South Africa Fund, and India-UN Partnership Fund, which our office very proudly supports to manage, started to adapt its support at this point to give immediate, very efficient, direct support to countries in need through, the South-South funding mechanisms. We hope more of such funding mechanisms will do the same. And by connecting partners and, connecting funding mechanisms and sharing knowledge, I would like to offer you to look at the South-South Galaxy platform, which is put forward by UN Office for South-South Cooperation together with over 15 UN agencies and many of our partners. It's as a global knowledge sharing and partnership brokering platform. There is a question asking how we can have a database of demand, how we can help to collect demand and match supplies. Yes, any partner, you can share your demands, publicize it on the South-South Galaxy. You can also share what you can offer now, so that you either connect directly with a partner that would be interested to work together, or you can request us behind this Galaxy platform to help you broker this kind of partnership. We have started doing that since the very beginning of COVID-19 and have successfully brokered many partners at national level and subnational level, city-to-city support, for example. Above all of this, across all the policy advocacy, knowledge sharing, and connecting partners, we have digital innovation. So that the South-South, a lot of digital solutions are coming from the global South and are applied across borders. So what we could do is to map the solutions and needs on digital innovation and help scaling up digital innovations across borders, to build capacity in the long run to better apply digital solutions for this and for any future crisis. So these are the things that I have learned and being inspired by you, by today's discussion. Thank you very much. As we said that, today's word, cooperation, cooperation, cooperation is the only solution. Thank you very much.
Thank you so much, and thank you to all the over 200 participants who joined us today, and we will continue the dialogue. So we are now closing the webinar, and we wish you a good day and a good evening to the colleagues from Asia and other parts of the world.
Thank you, everyone. Bye-bye.
Thank you.
Be well. Take care.